So over the last few years, we've recruited about 40 cardiovascular physicians to Bluhm Cardiovascular Institute here at Northwestern, including myself. I've been here for a little over a year. I think what makes this place a great destination for top physician talent is the culture. This is a place that really focuses on doing what we do better every day. There's a mindset here that there's nothing that we can't re-examine if it affects patient care. We were very lucky to be able to recruit Melissa Medina to join our team. She has a focus on heart failure, and in addition to her training as a cardiac surgeon at Stanford, she did a focused fellowship in transplantation and mechanical support at Baylor. She's very well trained out of the box, but more than that is just a very gifted technical surgeon and a great human being. In addition, I think you'll get a sense of what her enthusiasm is, both for the care of patients, but also for the training of the next generation. For us, having young surgeons who view themselves as educators from the very beginning is just core to being a learning institution. That's who we are.
My name is Melissa Medina. I am a cardiac surgeon at Northwestern Medicine, Bluhm Cardiovascular Institute, and an assistant professor at Northwestern Medicine, Feinberg School of Medicine. I chose Northwestern Medicine because I grew up in Chicago, and so when the opportunity for me to come back arose, it was an easy yes. As a little girl walking through downtown Chicago through the streets, I'd look up at the building at Northwestern and would hope and dream that at one day I would be able to work here. And so I'm really lucky and I'm very blessed to have this opportunity to come back.
One of the reasons why we've recruited so many new physicians and why in cardiac surgery we've recruited new surgeons this year is that our volume growth has been tremendous. In the last year, we've grown here at Northwestern Memorial Hospital almost 30% in volume. That is a great testament to how valued our team members are by patients, the demand of patients for increasingly more complex, technically challenging, specialized operations. That's really the reason for us to continue to grow.
The amount of growth that Northwestern has shown over the last few years is incredible. It's something to be recognized and something to be very, very proud of. I think that is a testament to the entire system and the team and everyone involved. In my first few months here, it was clearly apparent from the OR staff to the post-op ICU care and outpatient APPs, including all the residents and fellows, colleagues across medical and surgical specialties are all coming together to work as a team. And so it truly takes a village.
The spirit here is very much about collaboration and innovation, and there's now not an operation really that's done in cardiac surgery that is not performed here at Northwestern by one of our specialists. So one of my jobs as the chief is to recruit really good talent like Dr. Medina and to allow her to grow into the world-renowned academic physician that I know she's going to be.